this video, I will be talking about what is depression. How can depression be cured? Depression is an illness that causes people to feel sad, hopeless, and unmotivated. It can also make it hard to do everyday tasks. People with depression may have thoughts of suicide or self-harm. Many people experience depressive episodes, but most of them will not develop into a major depressive disorder and are known as adjustment disorders. An episode typically lasts from 2 weeks to 2 months, and about half of the time a person will experience more than one episode during their lifetime. All levels of severity exist in depression, from mild, where the person can still function well at work, school, or home, to severe, where the individual cannot even leave their bed or bathe themselves. The following 3 factors are the most common causes of depression. 1. Genetics. People who have a close family member with depression are more likely to be depressed themselves. 2. Life events. Major life events such as loss of a loved one, financial insecurity, or chronic pain can trigger depressive episodes. 3. Biological changes. These include premenstrual syndrome, PMS, childbirth, and menopause. The symptoms for depression are: 1. Depressed mood for most days over a 2-week period, sometimes called major depression. 2. Loss of interest in activities, either pleasurable activities or life in general. 3. Significant weight change, gain or loss. 4. Insomnia or hypersomnia. 5. Psychomotor agitation. 6. Fatigue and reduced energy. 7. Feelings of worthlessness and guilt, unrealistic expectations of self-performance in relation to personal standards. 8. Thoughts of death, suicide, or suicide ideation. 9. Diminished ability to think or concentrate, as well as indecisiveness. 10. Recurring thoughts or recurrent episodes of crying that is not related to external circumstances. 1. Unsafe or life-threatening situations. 2. Uncontrollable medical illness in which pain is intense and difficult to control. Treatment and therapy. Treatment options exist for even the most severe depression symptoms. The earlier you begin treatment, the more successful it will be. Depression is frequently treated with psychotherapy, prescription medications, or a mix of the two. If these treatments are unable to lessen symptoms, electroconvulsive therapy, ECT, and other brain stimulation therapies may be options to investigate. Because depression affects people differently, there is no one-size-fits-all method to treating it. It might be important to experiment a little in order to locate the medication that works best for you. Medications. Drugs called antidepressants are often used for the treatment of depression. They may improve how your brain uses particular chemicals that control stress or mood. You might need to try a few different antidepressants before you find one that alleviates your symptoms and has manageable side effects. It's common practice to consider a medicine that has previously benefited you or a close relative. Antidepressants often take 4 to 8 weeks to begin to work, and frequently, symptoms like lack of food, poor sleep, and attention get better before mood improves. Before deciding whether or not a medication would be helpful, it is imperative to give it a chance. After starting antidepressants, do not stop taking them without first talking to your doctor. Antidepressant users occasionally get relief from their symptoms, quit taking the medication on their own, and go back to being depressed. When you and the doctor have decided it is appropriate to stop taking the medication, which is normally after a course of 6 to 12 months, the healthcare provider will work with you to gradually and safely reduce your dose. Withdrawal symptoms may appear after a sudden discontinuation. Beyond therapy, actions you can take. Soon after starting treatment, you ought to begin to feel better. As you or a loved one receives treatment for depression, consider the following additional advice. Make an effort to engage in some exercise. Even 30 minutes of daily walking might improve happiness. Keep your bedtime and wake-up time consistent. Eat routinely and healthfully. Try your best to help. Establish what must be done and what can wait. Make an effort to interact with others and share your feelings with those you trust. Delay making significant choices, like getting married or divorced or switching jobs, until you feel better. Avoid using medicines, including those that weren't prescribed for you, alcohol, cigarettes, and other drugs. How do I get assistance? Make an appointment to see your doctor first if you suspect that you may be depressed. This could be your primary care physician or a medical professional who focuses on identifying and treating mental health issues. If you enjoy this video, give it a like, share, and subscribe to the channel for more updates. Thanks.